topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Houston. Welcome to another Ask the Expert show where we bring you the finest experts in the field of legal, health, financial, and home improvement. We have got the most incredible expert, and it was really funny because we promote the show about a week out, and then today we have heavy promotion. And we got a letter from a listener who listens to our next expert all the time, but she lives in Dallas. And she said, I wish I could come to Houston when I need a dentist because I love Dr. John Van Slate. And I was thinking, I'm here in Florida, and I was thinking, gosh, I wish John was here in Florida because I would travel to go see him. Let me introduce you to one of the finest cosmetic dentists in the city of Houston, Dr. John Van Slate. How about that for an opening?
That was wonderful. Thank you so much. I appreciate that.
I thought that was so cool because I started thinking, I said, God, even if John was 100 miles away, I would go to see him. People love, it's almost like, I guess, your bedside manner or the way you explain things. And when you go see a dentist, I want someone who's going to explain it where I understand it. And you're always that way every month, Dr. Van Slate.
Sure. Well, it's nice. I mean, you got to talk it where people can understand it. There's no doubt about it. It makes it a little easier.
Of course, we're getting so many new people every day finding the show. Tell people about your practice.
Well, I'm a general dentist. I have a probably more of an inclination towards the high-end cosmetic stuff and certainly TMJ, which we're going to talk about today, and
yes.
All those things are really intertwined more than people realize. But we also do the regular things. I mean, we do root canals, implants, all those kind of things too. But general practice. Love doing it.
And you are so good at dental implants and John, I think a lot of people take it for granted. They don't understand you have got all the latest technology in your office.
Well, I tell you what, it is a constant learning that goes on in dentistry. And that's one thing that we try really hard to do because you'll get left behind real quick if you don't. But yeah, I know that we did a show last time about, all the new stuff in dentistry, and it was pretty amazing, wasn't it? I mean, there was
It was crazy.
Yeah.
Crazy.
Yeah. Dentistry evolves.
In fact, right after the show, I'm going, how does Dr. Van Slate keep up with how things change so quickly?
Sure. Yeah. It's just a process, an ongoing thing. You got to keep churning.
Well, we did a show this morning in I believe it was in the Carolinas on Stop Snoring.
Sure.
And it seems like TMJ has something to do with snoring. Is that true?
That is extremely true. Matter of fact, it's one of those things where what comes first is, snoring and apnea and tongue position. Does that come first? Is it because of open mouth breathing? Does it cause the TMJ issues, or vice versa? With TMJ to posture the jaws to feel comfortable, does that create an open mouth breathing that causes snoring and sleep apnea? So they really do go hand in hand. You can have one without the other, but it's very common to have both of those issues at the same time.
Well, I know TMJ is very painful. What is TMJ?
Well, if you think about TMJ, it's short. TMJ is short for temporomandibular joint, and it's this joint right here in front of the ear, and you can feel it, Steve. If you put a finger here and you open and close, as you open it, you can feel the joint translating forward. That is the TMJ joint. And I guess what's unique about this joint is people, when they have TMJ issues, it's really self-diagnosable, because what people are going to have is they may notice a sound like a pop or a click is what's normally talked about, is that you'll hear a noise opening and closing. You can have a lot of tension headaches right in here, or these banded headaches across the head, some soreness in your face. But since the joint is right in front of the ear, these people will have a lot of tenderness right at the joint. And if you have a lot of inflammation at the ear, man, you get a ringing in the ear a lot. You can have a stuffy ear feeling, earaches, and just in general, you can have tension that'll even go back to your neck and in the back of your back. So it affects a whole lot of things, and it's not just one of those things. Or you can have one of those things that would be a TMJ symptom or issue. It doesn't mean you have to have them all. Most people have several of those symptoms when they have it, though.
I learned today also a lot of dentists don't even deal in TMJ, and you do.
Yeah. It's one of those things where it's dealing with a lot of pain patients a lot of times. And so I've done a lot of studying with this and taken a lot of CE with this. And so it's something you have an acquired taste for. And since I have so many people that I've done, complex cosmetic cases and implant cases on, a lot of these people have jaw pain. So you fall into it because you got to help them with the whole picture. And so that's why I've started doing a lot of TMJ in our practice.
What causes TMJ?
Well, that's always a great question. And I guess the best way to think about any joint in the body, doesn't matter if it's hip, if it's a knee or whatever, no joint likes compression, Steve. What a joint is, it's two bones that come together, and it's where rotation happens. Joints want space. And because you have ligaments, tendons, muscle, certainly blood vessels and nerves, you don't want to ever cause tension on those areas, right? Because that's what creates inflammation and pain. But specifically about the TMJ, there's really two areas that you think about. One is trauma, and it could be an acute pain that people will have, like usually a sports injury or a car wreck. They could have a normal TMJ pain, but they get a blow to the chin. That can cause a lot of compression and then acute pain. But probably the most common, the classic sign, is the clenching and grinding that most people will talk about. We clenching or grinding, and I think it's important to know that your teeth should never touch, Steve. And people think that clenching means that you're hammering down with a clench, but all clenching really is it means that you keep your teeth together a lot throughout the night and day. And what that does is when you keep your teeth together, you're compressing the joint. So that's a really big deal. And then other things that people don't really think about, allergies, or sinus issues can cause this. Why? Well, if you have sinus problems, you can't breathe through your nose. So as a result, you become an open mouth breather. You're going to breathe with your mouth open. They'll look like this. And the proper breathing technique, or the way you should be breathing, is with your lips together. Your tongue should be in the roof of your mouth, and you should be able to breathe freely through your nose. Okay. So if you can't do that, you're having to hold your jaw open or for a prolonged period of time, especially through the nighttime, which again causes a lot of muscle tension. So that's a big indicator. You could have arthritis of the joint, just like any other joint. You can get inflammation from arthritis. I guess another really big one is you can have with certainly arthritis, but you can have a deep bite, which means that when you have your teeth together, people that have a deep bite, you have a deep bite because if you look in a mirror, Steve, if you bite together, if you see only your top teeth and not your lowers, that's a deep bite. Well, people with deep bites, what they're doing is they're locking that lower jaw in, which can cause compression. And then posture is a big deal. We live in a world right now where everybody is looking down on their cell phones. Well,
yes,
it's called forward head posture. And you have forward head posture where your ear should always be right at your shoulder. In forward head posture, you're leaning forward a lot, right? And when you lean forward, if you think of your head just like a 10-pound bowling ball, Well, if you lean forward, you're adding 10 to 15 pounds per square inch with every inch that you lean forward, which puts a ton of tension on your neck. So you have to address the breathing, the allergies, you have to address posture, as well as anytime you're addressing TMJ issues.
We just got a text, John, from Tina in Memorial. What a great show. What happens if you hear clicking or popping noises in your jaw? Does that mean you have TMJ?
Okay. Popping and clicking is one of the biggest precursors to the TMJ symptom. Okay. Yes. And the reason that is this, it's very simple. If you think of it logically like this, you have an upper jaw that doesn't move. We call that the fossa. And then the lower jaw is like a ball. So it's a ball and socket joint. As we open and close, it's like a well-greased machine where the joint opens and closes. On the lower jaw, we have something called the articular disc, which is just like a hard ligament that serves as a cushion between the upper and lower jaw. When we open, the whole movement, that disc should be on the lower jaw to serve as that cushion. Well, when we have a pop or click, what will happen is the disc will fall in front of the jaw joint, right? It'll fall down, and then as you open, it'll click back on and then click back off, okay? We call that anterior disc displacement, but that's all it is. That noise is literally the clicking of that disc going from on top of the jaw where it should be to where it goes off. That's what causes it. So the key is we got to figure out a way to keep that disc on top of that jaw joint.
What about people who are suffering from jaw pain, John? Is that another sign of TMJ?
Absolutely. So just like we said earlier, yes, jaw pain, opening and closing. These people, a lot of times, when they open and close, will have soreness. They may have trouble chewing food because of soreness. It can be debilitating. I mean, I've got some people that literally everything they do with their jaw is a painful thing. So
how do you treat that?
Well, treating TMJ is multifactorial for one. Okay. But I can tell you my practice, I've been practicing and treating TMJ successfully for 20 years now. And I will tell everybody I'm as conservative as you can be. And I can tell you maybe on my hand how many times I've referred people for surgery with a jaw pain. Okay. So number one, I believe in being conservative. Most people, the way we're taught in dentistry is we're taught, hey, make a hard bite guard. We take an impression of somebody's teeth. We make a bite guard that's usually like a hard piece of acrylic, covers all the teeth, and it's a flat plane. And we say, wear that at night. Well, what I can tell you now, that all that we know about the jaw joint, huge paradigm shifts in that way of thinking. Paradigm shift number one is now we're advocating a daytime and a nighttime appliance, not just wearing it at night. And the logic to that, Steve, is just think of it this way. Decompression is the key. We got to take that pressure off the joint, right? Well, if we only wear it at night, if we take it off during the day, we compress again because we're talking, we're eating, we're doing everything we do. So you go all day long compressing the joint again. The only way to get real healing is you got to have a daytime and nighttime appliance. And, my nighttime appliance looks kind of like this. It's got an upper and lower part to it. But if you can see those little wings that are hanging off there.
Yes.
What that does is we find a position where the jaw is comfortable. And if you're sleeping on your side or your back, those little wings position your jaw in an optimal position. Okay. And that's what keeps all the stress off the joint when you're sleeping. And then during the day, we have more what people might be interested, more familiar with. It's just usually on the lower teeth. But even this appliance has huge, huge differences from our conventional bite guard. It might not look like it, but it is. Number one, when you're treating TMJ, you've got to make sure that the muscles are calm, right? You got to make sure there's no tension in the jaws. You got to make sure your joint is totally decompressed for healing. I actually use a computer, Steve. There's a computer program that's like an EKG and I'll show you a picture. This is what it looks like when I have somebody hooked up.
Oh my gosh.
Yeah, so they've got these little leads and they go on certain head and neck muscles. And what that does is I hook them up to a computer and then I can find where the muscles are totally at rest and where the joint is fully decompressed. So I can take an impression at that spot. And remember, it's not arbitrary anymore.
How do you get a patient to relax?
Well, that's a great question. We TENS them. And I don't know if you're familiar with TENSing. It's a machine that is used a lot in physical therapy to relax muscles. But we'll TENS their jaw joint and their neck muscle to relax things. It really relaxes all the muscles, and it creates great data for me to collect on my computer to find that proper jaw position. So once I find the proper jaw position, I can make an appliance now that's exactly the right height, that I know that when you bite into this, the muscles like that position and the jaw joint loves that position. Okay. So this is how we're treating, the TMJ, 2 appliances.
Do you make those in-house, or do you have to send them out?
Well, this appliance I send out to a lab that makes these appliances. This is all they do. Okay. They make these types of appliances, and they're the best at what they do. These are all milled via computer now. They aren't done with stackable acrylic like we used to. Totally milled by computer. And the advantage to that, Steve, is if somebody breaks it, somebody loses it, I just call them up and say, mill me.
That's right.
And they can mill one, and we can get it back to the patient without having to go through all the process again. Okay. Huge advantages here. Okay. But another big advantage with this, instead of a flat plane like the conventional bite guards, these, I don't know how well you can say it looks like teeth.
Yes.
Okay.
They do.
So what that assures me is that when I find that nice position, just like our natural teeth in the mouth, I want a natural home base where every time they bite together, they go to that home base where the muscles are at the right spot and the joint is compressed. So those are the big advantages with TMJ that we're doing now. And it's
how long do they have to do that for, John?
That's a great question, Steve. And this is probably the biggest question that I get all day long with these appliances is, how often do I have to wear them? How long do I have to wear them? Okay. Well, the answer to that question is it varies patient to patient, and it varies with the severity of the pain. Okay. I've got some people who can be weaned off the appliances when we get good healing. I've got others who I feel like it could be a lifetime wear. I've got many people that have been in appliances for 25 years plus. Okay. Yeah. Now, here's my take. I think literally everybody benefits from a bite orthotic, because if you have something you can put in that will protect your teeth and your jaw joint, even before you have pain, right? Before things can happen, it's going to benefit everybody. So I'm a huge advocate of really anybody can benefit from this, but certainly anybody with TMJ. But all these appliances, Steve, I call this phase 1. Because people always go, can I get to a point where I don't have to wear them? Okay. Phase 2 is things that we're doing like orthodontics. You can actually move the teeth to the correct bite position. Okay. It's a little bit more intricate than regular ortho, but there's a way to move the teeth to the correct position where we got the optimal bite. Okay. And then, of course, if somebody has a lot of wear on their teeth and a lot of missing teeth, then I might need to put, we call it full mouth restorations, where I put crowns or veneers on all their teeth to create that proper bite position. That would be phase 2. Okay. So you can see where it's patient to patient. It depends on the severity of the case and the comfort of the person. So I'm glad you asked that.
Here's one of your patients. Great show, Dr. Vansley. I want to know, does a person's bite change over the years?
Absolutely, yes. Okay. Our bites are not static. Our jaws are not static. As we age, we can get different remodeling in our jaw joints. We can create wear on the teeth that happens over time. As we wear, our bite position changes. Okay. So you can be a person that's always had a good bite, and over the years, you've worn down to a position that is no longer a comfortable bite. And so the answer to that is, yeah, it changes, and sometimes dramatically, depending on biting, clenching, grinding habits.
So does this help with people who have sleep apnea?
Yes, like we were talking about earlier. Okay. Think of it like this, Steve. If you have sleep apnea, okay, what is the cause of sleep apnea? It is open mouth breathing, right?
Yes.
Usually somebody, when they're sleeping, they got their mouth open, they're breathing through their throat, right? It's creating strain on the jaw muscles, okay, that can create a TMJ issue. Vice versa, some people have such problems with their jaws, they're trying to hold their jaw open to get out of pain, and it creates an open mouth situation, right? But the bottom line is with sleep apnea, many times I've got to treat both. We've got to treat people for sleep apnea and TMJ with appliances at the same time to get them comfortable. Okay, it's very common. So the answer to that is yes. And so a lot of times I'll have people literally take a sleep test to find out how, about their sleeping habits. And if they need for the sleep problems to be addressed, and certainly if they have sleep apnea, that's something we've got to address to get good, comfortable results with TMJ.
Barbara in the Galleria area wants to know, do you also treat tongue thrust?
Yes. Okay. Tongue thrust, what you'll see with tongue thrust is it creates an open bite, right? So these people, when they put their teeth together, their teeth are always a little open like this. Okay. So we have to work sometimes with tongue therapists or, people that can basically give people posturing of their tongue lessons and exercises to do to make sure that you can eliminate those tongue problems. Sometimes people have, if people have ligaments that like a tongue tie, sometimes we have to go in there and use a laser to remove that tongue tie to create proper tongue posture for these people. So that's another great question for somebody to call in about, because tongue can really affect not just snoring and apnea issues, but certainly TMJ issues.
I swear your show goes by so fast.
Are you there already, Steve?
Can you believe it? Tell people
that went by really quick.
How they can call you and your website address too.
Sure. Well, our website is drvanslate.com. I'm here in Houston, and our phone number is 713-783-1993, and that's 783-1993.
Yeah, and if you missed any of the show today, or if you have a friend that you think might be suffering from TMJ, they can just go to the iHeart library and put in Ask the Experts, put in TMJ, and today's show will come up. Dr. Van Slate, I love doing the show with you. I learned so much from you.
Well, you're the best, Steve. I enjoy our conversations every time.
And congratulations, your daughter just got married, right?
She did. Wow. Thank you so much. Yeah. I don't have any grandkids yet, but I'm sure that's around the corner somewhere.
Yeah. You can play with them in your spare time, right?
Yeah, exactly.
Dr. John Van Slate. We'll see you again. Dr. Van Slate's with us every month. Thanks, John.
Thank you, Steve. Have a great day.
You too, bro. That's Dr. John Van Slate. He is amazing. He's in the Houston area. He does any kind of cosmetic work. Anyhow, that's it for us today. We'll be back again with you next week with more Ask the Experts. Thank you, Rebel. We'll see you all next week.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.